The following presentation will describe an expansion of telepsychiatry at a CommuniCare rural mental health care clinic in central Kentucky. Telepsychiatry is a service delivery system that uses two-way video conferencing technology to provide mental health care to rural areas. The mission of CommuniCare is to utilize core values to ensure the provision of behavioral health and developmental and intellectual services aimed at improving the emotional, physical, and mental health and overall quality of life within the community served. A well-functioning telepsychiatry program that allows for appropriate treatment and continuity of care for rural patients can allow the agency to meet their goals of increased access to care, improved outcomes, and enhanced quality of life for the patients they serve. A market analysis shows that telehealth in the general healthcare market is flourishing. There have been 3 published reports of the success of such programs in Kentucky. Dalish and colleagues report that the implementation of telepsychiatry has the potential to reduce cost 40 to 70% when compared to traditional face-to-face services. An internal market analysis shows that telepsychiatry fits well within the CommuniCare organization by helping to further the agency's mission and goals, as well as allowing CommuniCare to stay abreast of the technological advances and be competitive with other telepsychiatry markets in Kentucky. An external market analysis reveals that telepsychiatry fits within the broader healthcare organization. Telehealth in general is an innovative concept that has a huge potential for growth and is rapidly increasing and integrating into all facets of modern healthcare. Please see the SWOT analysis table that further identifies the strengths, weaknesses, opportunity, and threats of telepsychiatry. A business plan was developed for integration of telepsychiatry into the agency. In Kentucky, there are approximately 181,000 adults and 45,000 children that suffer with serious mental illness. Unfortunately, only about 18% of these residents receive care through Kentucky's public mental health care system. The majority of Kentucky counties have limited access to mental health care providers, with CommuniCare's regional district having an estimated 0 to 19 mental health providers per 100,000 residents. Telepsychiatry is desperately needed. To begin implementation, the first course of action would be to research and choose the best telepsychiatry software that meets the needs of the agency. The second step would be to conduct a survey of the existing technology infrastructure to ensure that the modality can be sustained in the rural area. Current equipment would need to be upgraded to include remote internet connectivity capabilities such as Wi-Fi and a high-definition web camera for superior video clarity during a video conference. Once the infrastructure is available to deliver care, the next step is to begin creating an outline of how telepsychiatry is to be used at the agency through detailed policy and procedures for personnel who will be using the service. Once these steps have been taken, a pilot study can be conducted. Broad outcomes to be evaluated include improved access to care, cost-effectiveness of the service, ease of equipment and use of software, and improved patient outcomes. The video cloud-based video conferencing software will be selected for implementation of telepsychiatry services at the clinic to ensure connectivity from virtually any location that has internet capabilities. The leasing of this software includes the annual licensing fee at approximately $11,495. Equipment costs include 2 portable devices with web cameras at approximately $1,000 each. The additional cost of a provider at roughly $104,000 per year makes the 1-year estimated startup budget $118,500. Since there is already an existing patient care clinic, factors such as land and buildings are excluded from a capital budget. The cost for equipment have been included in the startup budget, so the resulting capital budget for implementation at the CommuniCare clinic is 0. Daily operating expenses include the cost of running telepsychiatry software and the cost of supplies and personnel needed to perform the service. There are no additional building or employee costs related to the use of telepsychiatry, as many of these resources are readily available and included in the operating budget of the clinic overall. Therefore, the 6-month operational budget is estimated at $59,250. The Gantt chart included in the poster presentation details a 1-year timeline for implementation of the expansion project. I would invite the audience to think about the ways in which technology can improve your role in healthcare. Do you feel that technology can replace traditional face-to-face services in your workplace? If so, do you feel that the patients would accept this new modality? There are many unanswered questions regarding how telehealth and telemedicine will affect future services, and it is interesting to know how others view this concept and its influence on modern healthcare delivery. I encourage any feedback that you may have. Thank you for your time.